You also have a copayment on your specialist visit. Urgent care and emergency room are also at a copayment of $100 or $250. So the big difference between this plan and the other plan is that you have a lower deductible to meet, and also you have your copayments, which are the same. So the deductible is what really is different with this plan. And the way you pay for your the way you pay for the out-of-pocket expenses to you is through a savings account, which you can set up with Fifth Third Bank. They don't really use any particular bank here. I think there's 3 different banks the people that are on it have set up. So talk to Tom about setting up a health savings account. And what you would do is you would fund that money with your extra premiums, because this plan is a little cheaper, or you can fund it with pre-tax dollars. And then when you have to pay for your co-payment or your deductible, you would take that out of your savings account and pay your doctor's with it, because you'll get a card that looks similar to a credit card. Okay. Now, if you'll flip back to the second last page of this plan, your prescription drugs are the same as your PPO plan, with the exception of the Tier 3. You have a $10 Tier 1, $35 Tier 2. Instead of a $70 copayment that you have on the PPO plan, your copayment is $60. And your network mail order is $150 for the Tier 3. Again, you have specialty copayment, which are $10, $100, and $300, which is the same as the PPO. And again, you would have to go through your retail pharmacy in order to get your specialty drugs if you fall into that category. If you don't know what your drug, if your drug is a specialty drug, there are a couple of different ways you can find out. You can go online and pull up the list of drugs there, or you can call the customer service number and they will help walk you through what a specialty drug is. So if you're paying a lot for your drug now, chances are it's either a Tier 3 or a specialty drug. Any questions so far? Okay. I do have the rates for you that I'm going to be passing out. These are on a bi-weekly basis, which means that each time you get paid, this is the premium that you'll have depending upon what you've elected. So if you're staying with the PPO plan and you want single coverage, every paycheck it'll be $58.63 for yourself. If you've covered a spouse, it's $128.22. An employee and children is $98.60. Family is $180. If you look down further, the health savings account plan, the employee only is about $9 cheaper per pay, or $18 a month cheaper. So you can take that savings and put that into your health savings account. The employee and spouse is $108.76. Employee and children is $83.65, and family is $152.64. There's also something this year that TesTech is putting in place called a spousal surcharge. What this means is that if you have a spouse that's on your plan now, and you want to cover them under this plan, but they have coverage that they could take with their employer, it's just that your plan might be better or cheaper, and you want them on your plan here, it's going to cost an extra $50 per pay to put them on. And there is a form that we have that if that applies to you, you would have to complete it and turn it back in, showing who your spouse is employed with and that they have coverage. Okay. I also want to go over with the healthcare reform. If you live and work in Ohio, You can cover your dependents up to age 28. They have to be unmarried, and they cannot have coverage through their employer. So if you have a son or daughter that's 27 years old, unmarried, doesn't have to live at home, just unmarried, and they work for someone here locally and they have health insurance, again, it's the same principle as the spousal. You won't be charged a surcharge for that. You just can't cover them under the plan. But if you have an unemployed son or daughter, or someone who works part-time and they don't have coverage, as long as they're unmarried, you can put them under your plan up to age 28. The federal government allows you to put them on the plan up to age 26, but they can't have other coverage.
What about college? Full-time students?
They're covered.
Even if they have some other type of insurance after college?
Yes. Okay. Now the right-hand side of your packet is a lot of information from United Healthcare. There's some brochures in there that outline the nurse services, preventative care guidelines, online health assessment, and how to get on the website. But really all you need is there's a booklet in here, and it looks like this. The booklet has everything that these individual pieces of information have on them. So I'm kind of going to go through that booklet. If you'll open that to page 2, there's a sample of what your ID card is going to look like on page 2. Now remember, you're going to get this in the mail, so in the next couple of weeks, around the 1st of April, be sure you look at everything that comes in the mail, because it will look like junk mail, most likely. They don't want somebody to steal your card, so it's not going to say United Healthcare on it. The card will, but the outside of the envelope may look very plain, generic. So open up on your mail. The back of the card shows your provider where to file the claim or where to call to get verification. And it also has the website on it that they can go on, as well as yourself. On page 3, it talks about the website, and you want to go to myuhc.com and click on the register button. And I really do encourage you to do this if you're not very computer literate, then get someone to help you with it. Because once you go online, you can get a myriad of things that you can look onto. You can view your claim. If you forgot what your benefits are, you can look up your benefits. You can find a doctor. You can also go online to see what drugs are out there. They will also give you an alternative to a drug. If you key in what your drug is and ask it for alternatives, then it will give you that as well. And then you can talk to your doctor about maybe your drug's too expensive, and maybe you can get it under the tier 1 or tier 2. Talk to your doctor about that and see what they say about it. On page 10, if you'll flip through that, it talks about your annual checkups and the 24-hour nurse. There's a 24/7, 365 nurse that's available to you on the nurse line. So if you don't know if you should go to the hospital, the urgent care, or just wait till the next day to go to the doctor, you can call the nurse line and they will assist you from what you tell them, what your options are and what's the best thing to do for you. Some people kind of go to the urgent care or the emergency room, and it's really not an emergency. You don't want to spend that $100 or the $250 if you don't need to do that. On page 14, there's disease management and case management. So if you have one of the disease management, chronic kidney disease, infertility, obesity, a transplant, congenital heart disease, pregnancy, any kind of women's health, or any kind of neonatal care, you will be contacted by United Healthcare, and they'll kind of give you some guidance on how you can manage your care. On page 17 is a copy of what your health statement is going to look like. We don't call them explanation of benefits any longer. We call them health statements. So you'll notice that it gives you where your member ID number is and the statement period. And then in the section that says this is not a bill, it will outline who your provider is, the date of service, and what was paid. On the next page, on page 18, you can also track your expenses. You can see how much your doctor's office visit costs. You can estimate what your future spending will be based upon your previous health condition. On pages 21 and 22 are some online tools for health assessment. It's a free online health quiz to see how you're progressing with your health. You can also click on the health coach for information. There's also a discount program out there from 10 to 25% on certain wellness products, as well as expectant mothers can go on and enroll in the baby support. You will get a monthly email newsletter online if you register. So there's a lot of different things that you can do out there if you would go online. Is there any questions? No? Now, you've all completed your form fire many times, I'm sure. So, if you decide that you want, if you the form fire application shows that you're in the PPO plan and you want to go to the HSA plan, you'll have to go in and make that change one more time. If you're new to the health plan, then I'm checking, but I believe you would have to go on to form fire and enroll, but I'm double checking on that to make sure. Everything we do now is through the form fire system, and even though you think it's a pain, next year you can just go in and update.
When would this coverage start?
The coverage starts April 1st.
So is there like an open enrollment period, or is this?
Between now and April 1st is your open enrollment period.
Before that?
Those of you who have already gone through the form fire process, you should have your card by April 1st, yes. And we will definitely try to get everyone their card, no matter when they sign up by April 1st. If not, a temporary ID card if they're changing their plan, or if they're just coming off of the plan as a new employee. Has anyone here got their spouse covered under your insurance that's covered elsewhere? Or that could be? Okay, I'm going to have to get you a spousal form then.
Well, I'm actually on my husband's right now, and we have United, so we were going to get it the benefits for TesTech is being better.
Oh, they're not covered. So you don't have coverage with?
No.
Okay. All right, well, I'm going to be here this morning, so if you have any further questions that you want to ask privately, just feel free to come back and see me. Thank you.